Ever wondered why X-rays show areas of opacity and lucency? Let's dive right into it. Radiology is a crucial part of medical practice, and chest X-rays are among the most common diagnostic tools we use. Understanding the basics is important, regardless of your specialty. Now, when you look at an X-ray, you'll notice some areas appear white, while others are black. We refer to the white areas as areas of opacity, and the black areas as areas of lucency. But what causes this distinction? It's all about how the X-ray beam interacts with different structures in our body, structures that all have varying densities. Think about it this way. An X-ray beam has a tough time passing through dense structures like bones. These structures obstruct the beam, causing them to appear white on the X-ray. On the contrary, our lungs, which are filled with air and thus less dense, allow the X-ray beam to pass through easily. As a result, they appear black on the X-ray. Now here's a key point to remember when interpreting a chest X-ray. Always assume that the patient is facing you. Why is this important? Because it helps you correctly identify the right and left sides of the patient's chest. Your left corresponds to the right side of the chest X-ray, and your right corresponds to the left side of the chest X-ray. This might seem a bit confusing at first, but it becomes second nature with practice. So, let's recap. When you're looking at a chest X-ray, remember that white areas represent denser structures, while black areas represent less dense structures. And always remember that the patient is facing you. This knowledge is fundamental to accurately interpret what you're seeing and make sound clinical decisions. Remember, in an X-ray, the patient is always facing you. That's a handy tip. This is just the beginning of our journey into understanding chest X-rays. Stay tuned as we delve deeper into this fascinating subject in our upcoming segments. Before diving into the X-ray, always confirm the patient's details and the X-ray's quality. This is a crucial step to ensure accuracy and prevent any potential misinterpretations. Begin by confirming the patient's name. This might seem basic, but mistakes can happen, and it's essential to ensure that you're looking at the correct patient's X-ray. Next, check the date the X-ray was taken. This information is vital to track the progression of a condition or to compare with previous images. Moving on, determine why the X-ray was requested. This context can guide your interpretation and help you focus on specific areas of interest. Remember, the reason may not be apparent from the X-ray film itself, so you might need to refer to the prescription or ask the patient directly. Finally, identify the view of the X-ray. The most common views are the posterior, anterior, and lateral views, which provide different perspectives of the chest. Each view can reveal different details, so it's important to know which one you're dealing with. Now let's shift gears and talk about the quality of the X-ray. There are three main parameters to consider: rotation, inspiration, and exposure. Rotation refers to whether the patient was standing straight when the X-ray was taken. If the patient was turned to one side, it could distort the image and potentially lead to misleading interpretations. To determine if an X-ray is well-centered, check the distance between the lateral borders of the clavicle and the spenous process. If these distances are equal on both sides, the X-ray is well-centered. Next, consider the level of inspiration, which affects the appearance of the lungs. An underinflated lung might appear denser than it actually is, leading to potential misdiagnoses. Lastly, assess the exposure. An overexposed X-ray might obscure finer details, while an underexposed X-ray might make it difficult to discern certain structures. Quality is key. Always check the X-ray for rotation, inspiration, and exposure before proceeding. Remember, a good interpretation starts with a good X-ray. Rotation and exposure can significantly impact your X-ray interpretation. Let's break it down. First, rotation. If a patient is not perfectly aligned with the X-ray, it can skew the image. For instance, consider the relationship between the clavicle and the spenous process. If the patient rotates to one side, the distance between these 2 points changes, causing the lung field on that side to appear darker than the other. This can lead to misinterpretation if not recognized. Now, let's discuss exposure. Exposure refers to the amount of radiation used during the X-ray. Too much exposure can result in an image that's too bright, obscuring details. Conversely, too little exposure can lead to a darker image, making it difficult to see certain features. Remember, rotation and exposure can make a big difference in how you interpret an X-ray. Always keep these factors in mind.